We're going to go ahead and get started. We'll let people join and they can just start where we're at. This is being recorded. And so you'll get a recording after this. You'll get a PDF of the slides and a couple other links that we talk about today. Just a couple updates. I will be taking my camera off for the majority of this. I'll turn it back on at the end so you can see and we can ask questions. Feel free to ask questions as we go though, so you don't forget them. Chances are they might get answered, but maybe not. So I just don't want you to forget them. So you all have access to the chat box or the Q&A. You can use either one, whichever one works best for you. So we'll go ahead and get started. So first, thank you to the Georgia Department of Public Health and Georgia Strong families. We're super excited to be here today. It's because of this partnership with Georgia Strong families that we're able to have webinars like this about Count the Kicks, our evidence-based stillbirth prevention campaign. Super excited to be here and share all of this with you. I love doing these types of presentations. You all are our boots on the ground. You are our grassroots. This is what makes us successful and save babies and expectant parents' lives in Georgia. So with that, we'll go ahead and get started. As I mentioned earlier, my name is Megan Ockett. You can contact me at any time. My contact information is on the screen. Like I said, I love hearing from you all. You help us get better and do better, and it's because of you that we save lives. My background is in public health. I've been in public health for about 15 years, and I'm very passionate about maternal and child health, especially as it relates to systems change. I love trying to work with you and figure out in your workflow how to integrate Count the Kicks so it's easy to remember, it's easy to implement and integrate into your workflow. So as a couple of reminders, if you're just joining us today, this is being recorded and you will have an email after the webinar is over with the recording and a PDF of the slides, as well as a couple other links that we talked through today. So with that, we're going to dive right in. And one of the things that I love for doing this presentation is sharing this video right from the get-go. And I do this for a couple reasons. I like to share this video that aired on Good Morning America in 2017 for a couple reasons. The first being it's a feel-good video. It should bring a smile to your face. This is about baby Ruby, who's one of our baby saves. And when I talk about baby saves, what I mean by that is somebody like a parent has contacted us and said, hey, I was using your app. I noticed reduced fetal movement, or my home visitor told me about this app and I was using it. I noticed a change in my baby's movements. I spoke up to my provider and now baby's here because of it. So thank you. So this video aired in 2017, sharing a baby Ruby's story on how she was saved when her mom noticed reduced fetal movement, spoke up to her provider, and she was delivered. And when it was aired in 2017, we saw a huge spike in our app downloads. So we saw about 130% spike. I mean, just over thousands and thousands of app users. And what that really told us and what tells you is the power of storytelling. So anytime you have an opportunity to share videos like this, and we have a whole bunch on our website and on our YouTube channel, with the expectant parents you serve, please share them, because I promise you, this is what you're going to remember. You're going to remember baby Ruby today, and you're going to remember baby Nala, who we'll talk about at the end. So with that, this also does a really good job, if you're not that familiar with the campaign, of giving you a good idea of how it works and how the app works. So let's go ahead and watch this short video clip.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So that's baby Ruby's story. And like I said, we have several of those on our website and our YouTube channel. So feel free to share them with your expectant parents. And we even have a baby saved right there in Georgia with baby Kai on there that you can share as well. And I'll be sure to send that with the follow-up email that goes out. So before we go too much further, I just want to level set, and knowing the participation today and your backgrounds, I'm sure that you all know the definitions between stillbirth, miscarriage, and infant mortality, but just in case, I like to share this slide to clarify that what we're talking about today is stillbirth, which is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. You can see those definitions there. On average, we lose around 23,500 babies a year to stillbirth. And miscarriage is usually defined as loss of a baby before the 20th week of pregnancy. And then there's infant mortality, which I think is the one that probably gets most confused with stillbirth. But infant mortality is actually death of an infant before his or her first birthday. On average, we lose around 22,000 every year for infant mortality. And what I want to do is draw your attention to the fact that we're losing just as many babies to infant mortality or to stillbirth as we are to infant mortality. And that's not to underscore the tragedy and heartbreak that infant mortality is, but I want to highlight the fact that we're losing just as many babies, but we're not talking about stillbirth like we're talking about infant mortality, you know, the Back to Sleep campaign. And that's what we want to do today. We want to give you the tools and resources to be able to talk about stillbirth and stillbirth prevention with the expectant parents you serve, so that we can get to a point where it's not taboo and we're changing that narrative and we're decreasing the stillbirth rate. So diving in a little bit further of what those numbers mean, nationally, that means 1 in every 169 pregnancies will end in stillbirth, and the racial disparities are large. For Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over their white counterpart. Hispanic moms, 1 in 199. Indigenous women, 1 in 138. White expectant parents, 1 in 204, and Asian Pacific Islanders, it's 1 in 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. We lose 65 babies a day to stillbirth. That is like a kindergarten classroom, a busload of kids on their way to a field trip. If that happened and we lost a busload of kids every single day, that would be in the news, right? Like we would all be talking about that, trying to figure out ways to prevent it. That's what we need to be doing with stillbirth prevention. Let's take a little bit closer look at your Georgia data specifically. This is through 2018. So based on the most recent 5-year average, the stillbirth rate in Georgia is 8.32. So 8.32 deaths per 1,000 live births. That's what that means. If you look at that graph, Georgia is the red line, the US average is that teal line, and Iowa, which is where we want to get you to or surpass Iowa, is that yellow line. So you can see, unfortunately, you're quite a bit higher than the national, the US rate. And then when we have a race breakdown even further, you can see that much like the slide before, unfortunately, we have that Black African rate that is 2 times, sometimes 3 times over what the white rate is in some of these other race and ethnicities. So we have a lot of work to do. And that's why we're so excited for that Georgia Strong Families partnership, because together we will do this. We will decrease the stillbirth rate in Georgia. And so on average, you lose around 1,091 babies a year to stillbirth. So what we want to do is we want to get you to a point where we're saving 1 in 3 at-risk babies in Iowa. And I'll talk about that in a minute. So that means 32%. We've had a 32% decrease in the number of stillbirths in Iowa. So if we bring this to Georgia like we are and what we're working on and why we need you, we have the potential to save 349 babies on average could be saved from preventable stillbirths in Georgia. And so when I talk about 1 in 3 or that 32%, what I talk about and what I mean is this graph here. And so I'm based in Iowa. Our organization, while it's national, is based in Iowa. We were founded in Iowa. It's our backyard. This is where we began. We started in 2008, and I'll go into our history in just a little bit. But we had a soft launch in 2008. From 2008 to 2018, we saw a 32% reduction in the number of stillbirths in Iowa. Public health officials have stated there really wasn't anything else going on in Iowa that would have made such an impact on the stillbirth rate. It's not like every pregnant person received doula care, which would be amazing. We know that would have a positive impact on the birth outcomes. It's not like obesity dramatically decreased. In fact, that's increased, which is a risk factor. So all of these other risk factors have gone up, but the stillbirth rate has gone down. And that's what public health officials have stated Count the Kicks has done. And so in the first 5 years of the campaign, we saw about a 39% reduction in the number of stillbirth rate among African-American women here. So this is exactly the type of measurement we want to bring to Georgia. So we hope in a couple years from launching there that we'll be able to see significant decreases in the number of stillbirths happening in Georgia. We have a couple outliers there you can see, which I know some people ask me about, but that's why we look at that dashed line. We really want to pay attention to that trend, right? That downward trend. This is what we want to see happen in Georgia. Because there's some outliers like that, we know that things like a syphilis outbreak or a pandemic can greatly and dramatically impact things like a stillbirth rate. And so we want to really look at 3 and 5 year averages and that trend, knowing that some years will be those outlier years. So why are there such large disparities that exist and persist in stillbirth? I don't think that this is news to anybody, but I think it's so important that we continually talk about and continually strategize ways to get to a point where race is no longer a predictor of stillbirth. So researchers point to the following causes for these disparities: things like systemic racism, racism in healthcare, toxic stress, otherwise known as weathering. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society, and all that comes with it has led to real and pervasive health issues for Black women. Epigenetics, predisposition to certain conditions, access to healthcare, socioeconomic barriers. But it's really important to note that research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So what are some of the things that we're doing to reduce these disparities? And what are some of the things you can do to reduce these disparities? Well, making sure your material and outreach is culturally appropriate. We have an app in 14, soon to be 16 languages. We have culturally appropriate educational materials. We have videos and printed educational materials and FAQs. We have a health equity team, that should say. We have a director and a coordinator now who are continually looking and helping us strategize ways to work within marginalized populations and to ensure that we are being culturally competent and relevant. We're always looking for funding opportunities to reduce racial disparities that persist and exist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We're improving programming based on lived experiences shared by people of color through focus groups and community conversations. We have been working within communities considered to be marginalized, working outside typical healthcare settings, working through ways, a lot of different ways people are getting their health information through their pastors and ministers. We have faith-based outreach and toolkits and beauty salon toolkits and social media that's working that we know is evidence-based. So just a lot of different things that we're doing and working on. So I invite you to think through that in your own organization as well. Okay, so we know about the data, we know how prevalent stillbirth is, but let's talk about how fetal movement monitoring is evidence-based. And feel free to put questions in the chat or the Q&A as we go. I will answer them at the end, or you might find that I answer them throughout the presentation. I just don't want you to forget them. So I encourage you to put them in the chat or the Q&A as we go. So this is an evidence-based campaign. When I talked a couple minutes ago about how we were founded in 2008, we were actually founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through friends and pastors. And as they started grieving together and meeting for coffee, they soon realized that here they all sit with relatively similar experiences, yet we're told this rarely happens, that stillbirth rarely happens. And they thought to themselves, that can't be right, because we all have had this situation happen to us, this tragedy, and yet we've been told it's like getting struck by lightning or winning the jackpot. I've heard terrible stories of what providers have said to people after having a stillbirth. And so fast forward, we're going to jump ahead a little bit. The 5 founders, some of them were at a public health conference where they heard about a study done out of Norway, and that's what you see on your screen here. And what this study showed was that when expectant parents were educated on getting to know what was normal for their baby in terms of movement in the 3rd trimester, when they were educated on this and spoke up to the provider, the stillbirth rate decreased around 30% among this cohort. 30% was a decrease in stillbirth among this cohort of women in this research study. And so some of the founders hearing this said, that is amazing. We can do this. Kit County's been around for a long time, but the tools and the resources to be able to talk about fetal movement monitoring, to be able to educate and empower expectant parents, that has not been created. So let's come back to Iowa. Great things happen in Iowa. So let's come back here. Let's look at other research and evidence around this fetal movement monitoring and create this evidence-based, colorful, empowering campaign. And that's exactly what they did. They came back, they worked with Iowa Department of Public Health and created what you all know or will know about is the Count the Kicks campaign. And so Dr. Ruth Fritz, circled here, she was the only US researcher on this Norway study, and she's from Harvard. She's now on our medical advisory board as well. And I love this quote that she said, where she says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern. That's really important. We're going to talk about that quite a bit, that normal movement pattern starting at 28 weeks, and to speak up if they notice a change. So this full study is on our evidence page on our website that you can access at any time. So let's go through a couple other research and evidence behind the campaign that I know I get questions on. So one of my #1 questions I get at conferences and when doing this is just going to increase anxiety, right? I'm going to have all these expectant parents scared. They're not going to know what to do. And I'm here to promise you and tell you that that does not happen. Kit counting does not increase anxiety in most pregnant women. Here's another research study quote that says, one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And I'll tell you why that is in just a minute. We also have done our own study through the Des Moines University and the Harkin Institute and found that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. Because what you have now is a highly educated individual who understands her baby's normal movement, who understands when that movement changes, and now has data in their hands to show to their provider to say, look, this is not my baby's normal. I need to be seen and I need to be checked out to make sure everything's okay with me and baby. I think there's also added benefits that people don't always consider or think about. Things like reduction of preterm birth rate, fetal growth restrictions can be identified earlier, because sometimes the only way baby communicates with you is through movement. So if that changes, something could be going on. So you could identify things like fetal growth restrictions earlier, and you could help prevent that to get baby to full term. We also know that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. We have a white paper out right now, which I'll share with you in the follow-up email, that talks through how you're 4 times more likely to die if you have a stillbirth. 4 times more likely to die if you have a stillbirth. So they're intrinsically connected. So not only if we can prevent preventable stillbirths, we have an opportunity to potentially save the pregnant person's life as well. So why wouldn't we do this? It's non-invasive. It's low cost. It does no harm. And here's another quote: due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So let's go in and talk through how you implement Count the Kicks and really why movement's so important. So again, this is a stillbirth prevention public health campaign. It's evidence-based. You're educating birthing people, expectant parents, on the importance of tracking fetal movement in the 3rd trimester through the use of either our mobile app, which we'll talk about in a minute, or through our paper charts. And it's empowering. That's what I love most about this. It's empowering birthing people to speak up to their providers if there's a concern. So why do movements matter? Again, movement is one very important way a baby communicates before birth. And we know, and research shows, that a change in baby's movements can be an early sign and sometimes the only warning sign that baby may give when in distress. So when we talk about why this is so important, and when we think about it a little bit further, it's just like when you and I are sick, right? We change our activity. We are sitting on the couch, we're resting, we're sleeping a lot, we slow down. Baby's movements may become weaker during that time of distress. It's just like us. When a baby's not feeling well, they're naturally preserving that blood flow to vital organs such as the brain and the heart to conserve energy and self-protect. That's why it's so important to pay attention to this in the 3rd trimester. There's 3 particular movements that I want you to be aware of. So when you're educating your expectant parents on this, you can inform them about this. The first one is obviously the baby has fewer or no movements. They slow down, which we talk about a lot. The second one deals with the strength of those movements. The baby may move, but the movements are softer or weaker. Remember baby Ruby's video when she said her movements just felt weaker. They didn't feel like normal. They were softer. We also want to be paying attention to not only how long it takes baby to get to 10 movements, but the strength of those movements. And then finally, the third one is a sudden wild surge of movement. Also, some people have described it as like an almost violent, aggressive surge of movement. Again, it's not normal. It's not their baby's normal movement pattern or normal movement feeling. That can also indicate that baby might be in distress and should get checked out. The main overall, I guess, theme of this is to know what your baby's normal is and to speak up if you notice a change. And we're going to help expectant parents understand and find out what their baby's normal is so they do know when to speak up if they have to speak up. So when do we want you to start educating on this? When do we want you to start talking about this with your expectant parents? third trimester. So 28 weeks or 26 weeks if they're considered high risk, because this is when research has shown that baby has really established a consistent pattern that we can feel and track. When you're talking to your expectant parents, they might be like, well, I don't know, I'm a first-time mom. What does it mean? Like, what's a movement? Because we're obviously called count the kicks, but it's more than just a kick, right? It's rolls, it's jabs, it's pushes, it's kicks, of course. It's anything except hiccups, because these are involuntary movements, so they do not count towards the fetal movement count. So when you're ready to start educating and talking to your parents about this, whether you see them once a month, and you need to start talking to them about, even if it's 24 weeks, because you're not going to see them again until their 32nd week, well into their third trimester, go ahead and talk to them about this and say, hey, when you hit your 28-week mark, I want you to use this app. And then when I see you again at 32 weeks or whenever, I want to see your data. I want you to be using this. So think through your own workflow on how often you might see expectant parents, knowing when you might need to educate them on it. If you see them every other week because you're a nurse or provider on the call today, awesome. Like, you can talk to them about it during the glucose test at 28 weeks. So we'll talk about that a little bit further. But as I go through this, I really want you to begin thinking about how you're going to integrate this into your current workflow based on how often you might see or interact with expectant parents. So how do you talk about this with your expectant parents? What they should do? So the first thing that you're going to do is obviously tell them that you want them to start counting their baby's movements starting in the third trimester. It's a great way to bond with baby and know that everything's going on okay, and to speak up to their provider if they notice a concern. So we want them to track their baby's movements with either our free app, which we'll go over in just a minute, or if they don't have a smartphone or they don't always have access to Wi-Fi or broadband, they can use our kick counting charts on our website that are in English, Spanish, and Haitian Creole. So feel free to go to our website and download those. So we want to educate them on counting their baby's movements every day. I cannot emphasize this enough. I will say it multiple times so it stays with you. You want to make sure they do this every day, preferably at the same time, because this is how they're going to really get to understand their baby's normal movement pattern. So what they're going to do is choose that time. Maybe it's 2 o'clock in the afternoon because they have some downtime before they have to go get the kids from school, or it's 5 o'clock at night before dinner, or it's 10 o'clock at night because everything's winding down for the day. They're going to time how long it takes baby to get to 10 movements using our app or the kick counting charts. And after just a couple days, they will begin to see that pattern for their baby, that average amount of time it takes to get to 10. They're going to continue tracking every single day around the same time. And then you're going to encourage them, if you're not their provider, or if you are their provider, to call you or call their provider right away, no matter what time of day it is, if they notice a change on how long it takes their baby to get to 10 movements or the strength changes. So now one of my favorite parts of the presentation is I ask you to multitask, and I ask you to take out your phones. The only presentation ever where I'll say, please multitask and listen to me while you download the app. And I want you to do this because I already have your attention and I know you're sitting here listening to me. So take out your phones and go into your app store, whether it's the Google Play Store or the Apple Store. And all you need to do is search for Count the Kicks, and you'll see that little yellow clock icon. And I want you to download it if you haven't already. And I want you to download it because I want you to see how easy it is to use. So that way, when you are talking to your expectant parents, you can pull out your phone, or you can say, hey, let's download it and go through some of these features together, so they're ready to start counting when they go off on their own and you don't see them anymore. So I'm going to walk you through how simple it is to actually do a session, and then I'm going to share some highlights of the actual app. So when they go in and they download it and they hopefully register, the one thing that they can do right away is they can start counting and they can register later. So let's say they already registered and they're starting to count. They just hit that red button. It's 2 o'clock in the afternoon. This is when I'm choosing to count with my baby. I know my baby tends to be most active later in the afternoon, so I'm going to count around 2 o'clock. So when I'm ready to count, I open it and I hit start counting, and I click, when I feel that first movement, I click that little foot icon that you see. And as soon as I tap that footprint, because I felt that first movement that I want to start with, a timer starts. So every time I feel baby move during my session, as I'm sitting here, I tap that footprint again, all the way until I get to 10. Once I get to 10, that timer stops automatically. And then what happens is the app will go and show you your data. So you can see that graph on the picture there. That is after a couple sessions. So you can see how user-friendly this is. So after just a couple sessions, they'll start to see that trend, that pattern of what baby's been doing and how long it's been taking baby to get to 10 movements. For this example, my baby takes around 15 minutes and 24 seconds. So it's around 15, 16, 17 minutes. So if one day I'm counting and all of a sudden it took an hour and 15 minutes, what happens to that graph is it's going to spike up. So it's not going to be linear anymore. So that's going to indicate to me as the app user to say, whoa, that's not my baby's normal. My baby's normal has been 15, 16 minutes for the last 3 weeks. And now all of a sudden it shot up to over an hour. I'm going to call my provider and see what they want me to do. And then together with their care team, shared decision-making, they can go in and talk through next steps. That's how simple it is. That's how easy it is to do. Some other key features that I want to highlight with you is that you can restart a session or delete a kick. That comes in really handy. Let's say I'm tapping and all of a sudden my 3-year-old runs over and taps the phone and there were no kicks to be counted. So I have to delete a kick so it doesn't mess my average time up. You can also set daily reminders within the app itself. So you don't have to go out into your calendar. You can just set those daily reminders right there in the app. So do that when you're setting this up with your parents. And then one of the best features I think is the fact that you can review and download the history. They can share it with their provider. They can share it with their family and friends. They could print it out and take it to their next appointment. So remember all about that empowerment, right? Tell them if your provider is not asking you about this, bring it up to them and say, I want to talk about this. I want to show you what I'm using. And I want to show you how important this is to me, because hopefully they are talking about it. But just in case, let's make sure that they're told about it from the parent themselves. You can count for single babies or twins. You can track future pregnancies on the same profile, and you can manage multiple devices. So I could be counting one day on my phone, and the next day my phone is charging in the other room, but my watch goes off. It's a reminder to start counting my little kicker. I can do it on my watch. Soon, we will also be releasing a web-based kick counter so people can count on the web, either at the public library, their own computer, at work if they can't pull out their phones, but they can access the website because it's purely educational, right? So there should be no blocks or anything like that. So that's coming out soon. So be sure to sign up for our newsletter so you can get all of that information when it comes out. The other thing that I wanted to highlight with this app is the strength tracking feature that we added last year. And so if you remember, a couple times I've already stressed the importance of not only just paying attention to how long it takes baby to get to 10 movements, but the strength of those movements. So if you remember here on this screen, we're counting the movements, right? We're tapping the footprint every time we feel baby move. When we get to 10, what actually happens is we get this screen that says almost done. Please fill out the following fields to finalize your kick session. And then the user has a rating system, right? They have basically 1 through 5 that they can fill out for coloring in the feet. And 1 meaning very fluttery. If you've ever been pregnant before, I would compare those fluttery movements to, like I always used to say, like gas bubbles or butterfly wings. Very fluttery, right? You wouldn't see those movements from the outside, all the way to a 5 or a 4, which would be fierce. So you feel those movements and you see those movements kind of on the outside. It feels like a foot is poking out or things like that. It really doesn't matter what they put here. What's most important is that it doesn't decrease, right? It doesn't change significantly. So with strength, when they're monitoring it, they get a bar graph. So it's different than the line graph, the dot graph that you see. And so that final screen before they click finish session, you can see up there on the top, they have that line graph, which is tracking movement. And then the bottom is the strength. So for this example, you can see this baby's movements was pretty linear for the last couple sessions. And then all of a sudden it shot up, showing me as the user to say, that took a lot longer than my normal, as you can see by the graph. And not only that, my strength decreased, right? I'm not saying that these have to connect or coincide at all. I'm saying that what the app does is gives you a visual representation of how baby's moving and feeling and the strength. So even if one of these changes significantly to the mom, to the user, to the expectant parent, they should contact their provider. So this is just an example of what it looks like. So Very user-friendly. Become familiar with it, use it, check out all the great features we have. Another great feature on the app that I really like to highlight is our Find Help resource. So this is just a data-driven resource. If you know or you have free or reduced cost services that you can offer in your state, you can actually go to this website and what they say is like claim it. So you can actually go and log it. So that way, when people search by their zip code, they can find all these free and reduced cost services. So maybe they're searching for childbirth ed classes or food assistance or diaper assistance or housing assistance. They can search that just by their zip code to see what's close to them, what's close to their work, what's close, if they need a bus line, that type of thing. And so this is on the app for people to access, because one of the things that we wanted to do is to ensure that we could connect people prenatally to resources that they need, right? That we all need. And so if we could do that where we already have this audience using the service, could we connect them to resources like this? And that's what we did. So they can enter their zip code and find resources that they need. So the fact that they can do that prenatally versus postpartum, the chance of that baby experiencing adverse childhood experiences can decrease dramatically, because now we've gotten them the food assistance that they need or the housing assistance that they need, and they don't have a crying newborn with their milk coming in trying to figure that all out. So that's on our resources section of the app. And now this video I want to share just kind of goes through the app in a little bit more detail, how to use it again. This is a great video to keep playing in your waiting rooms or when you're meeting with expectant parents, or if you do childbirth ed classes. It's also on the app. It's she's going to say, this actress here, she's going to say the app is in 12 languages because we shot this right before we increased it. So let's go ahead and watch this that you can share with your parents.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So just a fun little video that you can share with your expectant parents. Okay, so we know about the app, you've downloaded it, you're multitasking, you're messing around with it, you know how to use it. Let's talk about how you talk about stillbirth and stillbirth prevention and Count the Kicks with your expectant parents. But first, let's talk about health literacy. We know that health literacy is one of the strongest indicators of an individual's health status. And so what we can do and what you'll be doing when you talk about Count the Kicks and stillbirth prevention is you'll be improving their health literacy along the way, because you're going to be equitable. You're going to avoid assumptions and provide all expectant parents, no matter their race, their gender, their religion, socioeconomic status, sexual orientation, marital status, or education level. You're going to give them all the same information and interaction. You're going to listen and learn. You're going to ask strategic and open-ended questions about kick counting. What do you know about tracking your baby's movements? Let's talk about how to track your baby's movements. You're going to assess what the individual person understands, feels, and desires. You're going to be clear and concise. I've been using words like fetal movement monitoring a lot today. You probably won't do that. You're going to say, let's talk about your kick counts and your baby movements, baby kicks. You're going to avoid long or complex explanations and medical terminology, considering everyday vocabulary. And you're going to be honest. You're going to speak truth while still practicing empathy and compassion. And stillbirth is a hard topic, right? Nobody wants to talk about it. We'll go into that in just a minute. And then you're going to reteach. If the patient displays confusion or lack of understanding, make sure to correct or clarify. This is a perfect opportunity to say, hey, look how easy it is to use the app on my phone. Let's download it and have you go through a couple sessions. You can always delete those kick sessions later, so it doesn't mess with their graph, but have them practice right there in front of you of how to use the app, things like that. So how do we talk about stillbirth with expectant parents? You don't want to scare anybody. And one thing that I have to stress here is that we know, you all know this, pregnancy is full of risks that we talk to people about. We go through blood tests and we talk through genetics, and we talk about the importance of folic acid and not drinking. And my goodness, I was scared to eat cold meat sandwiches, right? I had to microwave it because I was told about listeria. Listeria rarely affects anybody, and yet that was drilled into me. So stillbirth is another risk that we have to be educating expectant parents about. They deserve to be educated about it. Expectant parents are not delicate flowers. We need to be told what could potentially happen and how we could potentially prevent something from happening like that. Stillbirth just happens. There's nothing we can do. Again, there's those warning signs if people know what to look for, but how are they going to know what to look for if nobody talks to them about it, or they don't see a brochure or a poster on the wall? Here's a big one that you're going to get when you're talking to expectant parents. I know I get this a lot when I tell my friends what I do and they're pregnant. I'm like, oh, download the app. They're going to say, oh, I don't need to do that, Megan. My baby's always active. It's not a concern. It's like a jungle gym in there. And I get it. I've had 3 pregnancies. I had a boy, girl, boy, and my boys were very active. And my daughter, I went to triage 3 times because I did not understand what her normal movement was. I didn't know it would take her 30 minutes to get to 10 movements when I was tracking, or my boys, it was like 5 minutes or less. So I would always say the same thing to these individuals that talk to me about this. And I say, that's awesome. A healthy baby is an active baby, but it's still really important to know if your normally active baby has slowed down, because cord and placental accidents can be sudden, and you need to know what's normal for your baby so you can notice that change. And takes the guesswork out of knowing it, right? We're busy individuals. So having an app or something like that to show us, like, we don't have to think, does my baby normally take 5 minutes, or is it more like 20 minutes? I'm not sure, because I've never actually sat down and paid attention. She's almost at her due date, a common, old wives' tale that you might hear a lot if you're especially working with multi-generational households. My grandma's always like, you're about to pop, but I bet you got 3 more weeks to go. Baby will come out walking, all those fun things that they say to pregnant people. The risk of stillbirth increases as somebody approaches or exceeds their due date, and it increases significantly. What about talking to people who have had a stillbirth previously about fetal movement? You're going to follow the same protocol. The biggest difference is you're going to start talking about stillbirth prevention and count the kicks around 26 weeks versus 28 weeks, because they're at a higher risk of having a subsequent stillbirth. And then feel free to talk about the previous stillbirth, acknowledge her child that was born still. If you're a provider listening today, make sure you check their chart if they're a new provider. If you're not, and they tell you about their experience, your home visit or something, being empathetic, which I know you all will be and are because of the field you work in, but it's okay to acknowledge and ask the gender, to ask the name, but stay away from those medical terms like fetal demise, of course. And then ask them, has anybody ever talked to them about the importance of tracking fetal movement before? We have asked a lot of our ambassadors who are lost moms, say, what were you ever told about this? And they said, no, I've had 3 living children, perfect pregnancies, perfect labors. And then my 4th, Nobody ever told me about, that I should be tracking fetal movement. I didn't know it was a concern. And why didn't I know? Why didn't I know? And so we want to turn that why didn't I know to I'm so glad I knew. I'm so glad somebody took 3 minutes out of my session today, my appointment, to talk to me about this. I'm so glad I learned about this in a childbirth ed class. That's what we want to do. That's what you're going to do. Some other common misconceptions and myths that we talk about. Here's that active one again, just another way to phrase it, because I know you're going to get it quite a bit. What about those only experiencing a high-risk pregnancy? Should they be the only ones that are educated on this? No, we want all expectant parents to be educated on this. We don't just talk about gestational diabetes or do the gestational diabetes test to high-risk individuals. We do that with everybody. Because stillbirth can happen to anybody. 10 and 2, 10 and 1, I've heard both, right? I'm sure you all heard it too. So again, this goes back to understanding what's normal for your baby. The recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates that moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. And I'll tell you why. And we have a research study on our website about this. But basically what it says is, as humans, like, we're focused on the time, right? Like I have you for 15 more minutes, right? Till 2:30 your time, I think, 1:30 my time. And so that's what we're focused on. And so when we tell somebody to say 2 hours, 10 kicks in 2 hours, that's what I focus on. So let's say I'm counting, and I've been counting, I get 15 minutes, 10 kicks in 15 minutes for the last 4 weeks I've gotten. And then all of a sudden I'm counting and I got 10 kicks in 1 hour and 47 minutes. And I think to myself, but that's okay because I got 10 kicks in 2 hours, but that's not okay. My normal for the last 4 weeks, my baby's normal has been 15 minutes, not 1 hour and 47 minutes. I need to call my provider and see what's going on. It's all about understanding what's normal for your baby. Here's another big one. I can use a Doppler, right? I can just download one of those cool apps and find my baby's heartbeat. A change of baby's heartbeat is one of the last things to occur when a baby's in distress, not to mention how hard it could be to find the baby's heartbeat, right? Or you could misinterpret it and it's your heartbeat. Whereas a change in baby's movements may indicate potential problems before actual changes in the heart rate are detected. Because remember, they're potentially slowing down, right? They're conserving that energy. Expectant parents should only use a Doppler device under the guidance of a healthcare provider. And even healthcare providers, when you go in with reduced fetal movement or change in fetal movement, they don't just do a Doppler and send you on your way. No, they're doing further testing, or they should be doing further testing, NSTs, biophysicals, et cetera. What about telling somebody, oh, drink a Mountain Dew, eat a Snickers bar? I've heard do some jumping jacks to get baby to move, right? Do something, eat something sugary. Again, and similar to the 10 and 2, I think this is a common misconception, and we're too quick to jump to doing this. Kick counting is best monitored without interventions like juice and candy, because if baby's not moving like normal, why are we trying to force baby to move, right? Again, when you and I are sick, I'm not drinking Mountain Dew to get going or chugging, a bunch of coffee as I'm like throwing up over the toilet. I'm trying to rest and conserve my energy. Why am I trying to force myself to move? Same with baby in utero. If something's going on, whether it's infection, umbilical cord, we don't need to force baby to move. We don't want to force baby to move, right? We need to contact our provider. What about they move less during then? They're running out of room, right? Well, they're not running out of room. They are getting bigger, but everything's growing, right? But they should move up to and even during labor. We all know this. The movements may change. You might feel more of those jabs, less of those huge body rolls. But again, if you are tracking your baby's movements, you should still feel about the same amount of movements in the same amount of time. Dental care, really, really important. Always encourage them to visit their dentist. That there's so much that happens with oral health and pregnancy. So making sure that they continue those visits. If I have any labor and delivery triage nurses on here, I hope you order the materials. If you work with labor and delivery triage, you have them come to your coalition meetings, or you can order materials and drop them off at their front desk. Please do so. That is the perfect place to have this information. Like I said, I went 3 times with my daughter thinking of she had reduced fetal movement, found out I just needed to understand that that was her normal, 30 minutes. And that would have been the perfect opportunity for the nurse to hand me a brochure or me to see a poster on the wall. I got sent home. Everything was checked out fine. She was delivered healthy and fine several weeks later. But that's a great opportunity to have that. Some other ways to integrate, and we won't dive into this too much, but I hope you've been thinking about, maybe you have intake forms or family care plans that you could add questions about. Do you know about Count the Kicks? Do you know about the importance of tracking fetal movement? And then you can put a flag on them. Let's say they come to you and they're 12 weeks pregnant and you're not going to see them again till, 4 or 10 weeks. Or however long it is. Can you put something on your calendar to remind yourself to talk to them about it? Could you have your front desk staff trained? Could you share this recording with your other team members? Could you have them download the app while they're waiting for their blood work during the glucose test? Speaking of discharge papers, when I went to triage, I could have had a discharge paper that says, here's how you count your baby's kicks. We have gold standards like that. So just contact me if you want to talk through this in more detail based on your own personal workflow. So now my second favorite part of the presentation is the fact that I get to play this fun song, Happy. And I want you to take a moment. I want you to come back, but I want you to scan this QR code or go to counttthekicks.org, which is right there. And I want you to click on order materials and click on Georgia and then fill your shopping cart and order. And then you'll be entered to win another gift card. But I want you to do this because one, you're right here, you're at your computer hopefully anyways, but two, it's just a good break that you can take a second to go do this. This takes 2 minutes. So I'm going to play this song for just a couple minutes, come back, go place your order, be entered to win a gift card, and then we'll wrap up with a couple other resources.
Might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you.
I know we all love Pharrell Williams, but I'm going to stop because I want to make sure you get out on time. So continue ordering. Again, I know we're all good multitaskers. So continue ordering so that you can be entered to win that gift card. But we're going to go ahead and continue in a second. Okay. The other thing that we have for resources is that we have this online CE training that you can take, and don't worry about writing down this URL. I'll send it in the follow-up email that gets sent out, but you can also access it for half off using that code. It's 2.2 CE, so I'll be sure to send that your way as well. It goes into a little bit more detail. It has a whole equity module than this one today. So I think it's really, really an important one to take. And then we have a lot of great free resources. We have a parent academy, stuff that you can send directly to your clients. Maybe you're not meeting with them in person yet. Maybe you can send them websites with, an email with a website link and things like that. We also have a provider academy. We have kick counting charts, again, in English, Spanish, and Haitian Creole. We have lots of different videos. And then we also have our ambassadors, our lovely, lovely individuals who are trained. They're highly invested volunteers committed to preventing stillbirths in their communities. You're lucky that you have two amazing women in Georgia that can help with this. We have Jada and Erica, who Jada is a birth worker, Erica is a lost mom. So passionate about this. So anytime you need something in person, as much as I'd love to fly to Georgia and see you all in person, I can't just do that very easily, but they can, right? They're right there. And so feel free, they're trained, they love what they do, and they love doing this in honor of the ones that they've lost. And then why do we do this, right? Like, why did you sit here for almost an hour and listen to me talk about fetal movement monitoring? We did this for babies like like Nala here that we're going to listen to, and Ruby and Kai, who was saved just a couple weeks ago in Georgia. And I'll send you his story when their parents were educated on getting to know what's normal for their baby, and they spoke up and their provider listened, right? Because they had data in their hands and they said, this isn't right. This isn't my baby's normal. I need to be seen. I need to have something done. And so we do this for babies like Nala here. And so we're going to show you her story. And again, this is what you're going to remember. This is a great story. This is a great video to share with your expectant parents, because this is going to stick with them. So let's go ahead and listen to her story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just going to take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
I like what she says, you know, don't worry about this. Don't worry about the emergency, your insurance, just go check on your baby. And I think that's a really key message, you know, and making sure that your expectant parents know that their providers are there for them, right? That's the whole point of being a provider. That's what they should be doing. No matter what time of day or night, they should be able to call or go in if they don't feel like they're being listened to their emergency department and get checked out through labor and delivery. So next steps is become familiar with the app, which you've already done because you all downloaded it. Ordering materials, which I know you've already done because we did it right here. This takes 3 to 5 minutes to talk about, right? This is not a hard conversation to talk through for it's going to take 20 minutes. This is 3 to 5 minutes every single time you see them in the 3rd trimester. Make sure your entire staff knows about this. Maybe even designate somebody to always order materials when they run out. Could you look at your electronic health records, your intake forms, updating discharge papers to ensure and talk about Count the Kicks? Could you change your answering message to include information on Count the Kicks? And then remember, hours and minutes matter in preventing stillbirth, especially, you know, if you're working in rural areas where people have a 60-minute drive to their nearest birthing center, or they think they can just wait for their family clinic to open up the next day, they need to get in the car and they need to be seen. They should not have to leave messages to talk to somebody. This should be expedited right away, right? And then connect with us, our newsletter, share our stuff on social media. Feel free to contact me if you have any questions or you wanted to talk through more on how you can implement this and integrate it really easily into your system. But hopefully this gave you some ideas today. I'm happy to stay on and answer any questions you may have. Just thank you so much for all of your time, your afternoon today for an hour. I know it's a lot to give in this busy world, but it truly is because of you that we're going to save babies in Georgia. And thank you to Georgia Strong Families for this partnership. April, I will absolutely share this presentation. A PDF will be coming your way. The recording will be coming your way. So with that, happy to answer any questions. Otherwise, you are free to go and have a great day. Thanks, April. Thanks, Christine.